system, you will begin to see breathing problems. Discharge from their nose, their eyes will begin to look murky. They also stop laying in laying beds. The bird's leg and wings become paralyzed and their neck twisted. Prevention and treatment. Older birds usually recover and are now carriers afterwards. However, most baby birds or younger birds will die from the disease. But the carrier birds will as well and can as well infect other birds that are not well vaccinated with Lassa. Second one is the fowl pox. The disease is caused by a virus called avian virus. The disease can be transmitted from virus carrier to other poultry through wounds or spread the virus even to a nearby poultry house. Symptoms: chicken develop white spots on their skin, scabies sores on their combs, white ulcers in their mouths or trachea. They also stop laying. It affects the well-being of that poultry bird. Prevention and treatment. Feed them soft food and give them a warm and dry place to dry and recover. With adequate care, there is a great chance that your birds can survive this illness. There is a vaccine that can prevent the healthy birds from contracting the disease, as the disease can be spread by other contaminated birds, mosquitoes, and can also be contracted from the air. Use strong antibiotics to handle this. Number 3, quail disease. Quail disease is caused by Clostridium collinum. A spore-forming bacterial rod is the cause of the disease. The infection spreads by the droppings from the sick or carrier birds to healthy birds once they are not vaccinated. The disease organism is very resistant to disinfectant and will persist under varying environmental conditions. Symptoms: birds with the acute form may die suddenly, while in a good flesh areas, the affected ones becomes restless and have ruffled feathers. They have whitish watery diarrhea and develop a hump-up position or posture. Infected birds usually die in an extremely emaciated condition. Prevention and treatment. Seek professional advice from your vet if you suspect infection. Bacitracin and penicillin are the most effective drugs in the treatment and prevention of this disease. If bacitracin is used, incorporate in the feed at level up to 200 grams per ton of feed. Addition of bacitracin to the water at the rate of 1 teaspoon per gallon aid in controlling an outbreak of the disease. Either method of administering bacitracin will control the disease within 2 weeks unless a bacitracin-resistant strain of the disease organism is present. Penicillin is also used to treat the disease if bacitracin is not effective. Number 4 is the botulism. Botulism is a disease caused by the ingestion of a toxin produced by the Clostridium botulinum bacterium. All domestic fowls and most wild birds are susceptible to the toxin's effects. If your chickens have contracted this disease, It means that there had been some type of dead meat left in their food and water that have been fully contaminated. Symptoms. Once they contact this disease, the chickens begin to have progressing tremors. The tremors will progress into total body paralysis, which includes their breathing. You also notice their feathers will be easy to pull out, and death usually occurs within a few hours from the contaction. Prevention and treatment. There is an antitoxin that can be acquired from a vet. Check any vet shop close to you and get an antitoxin. If you notice the disease earlier enough, you can mix 1 teaspoon of Epsom salt with 30 ml of warm water. Administer to the birds by dropping once daily. This disease is avoidable as long as you keep your chickens in a clean environment and clean up any dead carcass from around their environment. Number 5. Fowl cholera. The causative organism of fowl cholera is the Pasteurella multocida. Fowl cholera can be contracted from wild animals or food and water that has been contaminated by this bacteria. Symptoms. Birds begin to have a greenish or yellowish diarrhea and obvious joint pain. It can affect their movement as well. They also struggle to breathe and have a darkened hair or wattle. Prevention and treatment. There is no real treatment for now. If by some chance your chicken survives, it will still always be a carrier of the disease forever. So it is usually better to put them down and destroy their carcass to prevent the spread. There is a vaccine, however, for your chickens to prevent the disease. Number 6. Infectious bronchitis. The disease is caused by avian infectious bronchitis virus, IBV. Symptoms. Chickens begin sneezing, snoring, and coughing. And then the drainage will begin to secrete from their nose and eyes. Laying will cease immediately if they are laying birds. Prevention and treatment. You can get a vaccine to stop this disease from infecting all your chicken. Prevention is better than the cure because you cannot cure it. However, if you decide not to use a vaccine, quarantine as soon as you notice symptoms of the disease. Infectious bronchitis is a viral disease and will travel quickly through the air. To treat infectious bronchitis, give your chickens a warm, dry place to recoup. A warm herb tea and feeding with fresh herbs may help to reduce the secondary effect. It is a viral. You can't cure it. Number 7. Infectious coryza. The disease is caused by a bacterium known as Haemophilus gallinarum. Outbreaks usually result from the introduction of infected or carried birds into a flock. It can also be contracted through contaminated water and contaminated surfaces. Symptoms. Heads become swollen and with eyes and nose. Their eyes will literally swell shut and their comb will swell. Then a discharge will begin to flow from their eyes and noses. They will stop laying and they will have moisture from their nose and their wings will drop. They will find it difficult to eat than to drink even. Prevention and treatment. There is no vaccine to stop this disease. Unfortunately, once your chickens contract this disease, they should be killed and buried or burnt. or you use a very strong antibiotics to handle and manage it. They will remain a carrier of the disease for life, which is a risk to the rest of your flock. Keep your chickens protected from other random chickens and keep their coop and water clean to prevent the disease. Number 8, Marek's disease. Marek's disease is caused by a virus belonging to the herpes virus group. They actually obtain the virus by breathing in pieces of shed skin and feathers from an infected chick. This disease is very easy for them to catch because it is on air. More common in younger birds than are usually under the age of 20 weeks. Tumors begin to grow inside or outside of their cheek. Their iris turns gray and they no longer respond to light. They become paralyzed. Prevention and treatment. If your chicken gets this disease, it needs to be put down. It will remain a carrier of the disease for life if it survives it. However, you can give a vaccine to day-old chicks to prevent the disease. Number 9, thrush. It is a fungal disease caused by the yeast Candida albicans. Symptoms: a white oily substance inside their coop. The chicken will appear lethargic and have a crushy vent area, and their feathers will look ruffled. It is important to mention that thrush is a fungal disease. This means that it can be contracted if you allow your chickens to eat molded feed or other molded food, and they can also contract the disease from contaminated water or surfaces. Prevention and treatment. Though there is no vaccine, it can be treated by an antifungal medicine that you can get from your local vet. Be sure to remove the bad food and clean their water container as well. Number 10, bumblefoot cause. This disease is acquired. The chicken acquire this disease on wounds on the foot and it gets infected into them. The chicken may accidentally cut its foot on something or an object in the pen when digging in the garden or scratching around, and so many other ways they can as well get this if other birds injure them, and the disease can affect them through that wound. Symptoms: the infected wound swells up the legs. Prevention and treatment. Bumblefoot can happen very easily, and it's also not much you can do to prevent. Besides, just keep a close eye on your chickens. If you find out a cut on the foot, wash and disinfect it to prevent the disease from sitting into them. Number 11, air-sac disease. Air-sac disease. This disease is caused by an organism called Mycoplasma gallisepticum. Caused by Mycoplasma symptoms gallisepticum. Disease starts with poor laying and a weak chicken. As it progresses, coughing, sneezing, breathing problems, swollen joints, and possibly death occurs. Prevention and treatment. There is a vaccine for the illness. It can also be treated with an antibiotic from the vet. It can spread from bird to bird, so keep an eye out and watch the symptoms. Immediately it occurs, start treatment immediately and don't waste time. It can be treated quickly and effectively. Number 12, mushy chick. It is a bacterial infection due to improper closure of the navel. It can usually be traced to faulty incubation, poor hatchery, sanitation, or chilling or overheating soon after hatching. Usually, this disease shows up in newly hatched chicks that have a midsection that is enlarged, inflamed, and blue tinted. The chick will have an unpleasant scent and will appear to be drowsy. Naturally, the chick will also be very weak. Prevention and treatment. There is no vaccine for this disease, but sometimes antibiotics may work. It's usually transmitted from chick to chick or from a dirty surface where an infected chick was. Usually, it is contracted from an unclean area where a chick with a weak immune system contracts the bacterium. The best practice is to separate the birds from the chicks once in the case of disease outbreak. Number 13, poloron. The cause is a bacterium and Salmonella poloron. This organism is primarily egg transmitted, but transmission may occur by other means. It can be contracted through contaminated surfaces and other birds that have become carriers of the disease. Symptoms. The affected chicks are mostly the young ones, while the older birds may survive it. The chick shows no sign of activity and have a white pest all over their backside and show signs of breathing difficulty. Some will die with no sign at all. In older birds, however, you will see sneezing and coughing beside poor laying. Prevention and treatment. There is no vaccine for this disease. All birds that contract the disease should be put down and the carcass burnt or buried so that they will not disinfect or affect other animals or other poultry birds. Number 14, avian influenza. Avian influenza. It is caused by bird flu. It was one of my initial fear of owning chickens because all you hear about on the news is how people get sick with bird flu from their chickens. However, after knowing the symptoms, you'll be able to put the fear and have rest. You need to know how to act quickly if you are afraid your backyard birds have come in contact with it. Symptoms. The signs include respiratory troubles and birds will stop laying. They develop diarrhea. There may be swelling in the chicken's face and their comb and rattles discolored or turn blue. They may even develop dark red spots on their legs and combs. Prevention and treatment. There is no vaccine and the birds affected will always be carriers. Wild animals can even carry the disease from birds to birds. Once your birds get this disease, they need to be put down and the carcass burnt or buried. You need to sanitize all areas that the birds were before introducing a new flock. Take great precaution because this disease can make human beings sick.